time, a lot of therapies are going to be available for these patients. أنا وقت ما بدأش. For these patients, and it will help us more to know about the products and what suits the patient or our patient at what time. This is very important to be considered. So I'm happy in the session went this way. Professor Dr. Laila, I'm happy you started because you gave all the introduction that no one can give except you. So thank you. So this is about the management of hemophilia with inhibitors and the roles of activated prothrombin complex. That is the fiber. The history Professor Dr. Laila gave, and the incidence and the clinical manifestations. So I will go with the course and the prognosis of hemophilia. When factor VIII concentrate emerged in the 1960s, the morbidity and the mortality from bleeding in hemophilia decreased significantly. However, the replacement factor had its own complication that included development of factor VIII antibodies, liver diseases resulting from hepatitis B and C, and infection with HIV. The development of antibodies, these are specific inhibitor antibodies that neutralize factor VIII activity, most frequently seen in the severe patients, affecting 25% of the patients. Predisposing factors include severity of the disease, type of the genetic mutation, family history of the inhibitor. It is an allo antibody, IgG, 4 against the C2 domain of factor VIII protein, which interacts with other cascade cofactors. Seen approximately 9 to 11 days post factor VIII exposure. It is diagnosed by the mixing tests that do not correct PTT and the Bethesda assay, dividing them into high responders, more than 5 Bethesda units, and low responders, less than 5 Bethesda units. In the development of the antibodies, the treatment is to treat active bleeding and inhibitor ablation via ITI or immune tolerance induction, giving high purity factor VIII, procaine factor VIII, recombinant activated factor VII, or prothrombin complex concentrates, which are plasma-derived, highly purified, and having the anti-inhibitory coagulant complex used in hemophilia A and B with inhibitors, on-demand prophylaxis and perioperative, used in adults and children, and it has been approved since 1968, so a lot of data are present. In the manufacturing, it is عشان deactivate الviral because it's a plasma derived factors. It is double viral inactivation using a nanofiltration and a vapor heating and purification by chromatography. The half-life is 47 hours, and it contains physiologically balanced ratios ما بين الزيموجين forms of pro-coagulant factor 2 و7 و9 و10 with trace amounts of their active form, والanticoagulant protein C, and small amounts of coagulation factor protein زي factor 7, 8, or protein S, with tissue factor pathway inhibitor TFPI are also present. The mechanism of action, it involves induction or facilitation of impaired thrombin generation via the interaction with the endogenous clotting factor and platelets. The key component هم البروثرومبين activated factor 10 complex that has a procoagulant effect in vitro and in vivo. And this is one of the proposed mechanism is explained in 3 steps. Step 1, when factor 2 or when factor 2 and the activated factor 10 complex trigger the triglycerides on the membrane surface of tissue factor bearing cells or activated platelets, بيعمل prompting initial fibrin clot formation. والثروmbin immediately with feedback reaction leads to activation of other coagulant component and further platelet activation. الزيموجين والبروcoagulant enzyme component of activated prothrombin complex concentrate or fiber amplify triglyceride precipitating a thrombin burst. Due to the long zymogen half-life, circulating substance level increase, leading to prolonged hemostasis that prevent a bleeding recurrence. It contains natural clotting factors such as protein C and S, وهم بالamounts اللي موجودين they help or prevent thrombotic effects that can happen from the propagation of the clotting mechanism. Coming to the studies that show the efficacy or why we need fiber or what is fiber and its effect in the inhibitor patient population. This is under the FENOC trial, the FENOC trial is a randomized comparison of bypassing agents in hemophilia complicated by inhibitor, fiber, NOVO7 comparative study. It was a prospective head-to-head randomized crossover open label study, and the study objective included assess equivalence of fiber and recombinant activated factor 7 for the management of acute joint bleeding. The definition of equivalence was a difference أقل من 15% في الكلينيكال efficacy ما بين two products, and the primary endpoint can rating of hemostatic efficacy at 6 hours after treatment. يعني هو ده الستدي ديزاين. Fiber at a first dose of 75 ل 100 international unit per kilogram, where recombinant activated factor 7 أو NOVO 7 first dose 90 ل 120 microgram per kilogram. كل دوز من الفايبر قصادها 2 دوزز من النوفو 7، وده في الفيرست بليد، ولما بيحصل subsequent bleeding بيحصل كروس اوفر للبرودكت الثاني. A number of patients كانوا 48 patients with 96 bleeding episodes, والmean age كانت من 8 to 55 years old, with a mean age of 27.5, والmean inhibitor titer at enrollment كانت 86, ranging من 0 to 1,800. Hemostatic efficacy was evaluated at 2, 6, 12, 24, 36, and 48 hours after the start of therapy. We can it using a 4-point scale: effective, partially effective, poorly effective, or not effective. We're using the subject's evaluation to bleeding resolution. We did at the primary endpoint at the end of the when assessing the primary endpoint, fiber. Our patients rating fiber as effective or partially effective كانت nearly 81% versus 78.7% for NOVO 7. And this برضو is the rating of efficacy at 6 hours. As we said, nearly 81% rated fiber as effective or partially effective, 15% rated it as poorly effective versus 11% rating NOVO 7 as partially effective, and 4.3 non-effective versus 10.6% rating NOVO 7 as non-effective. The percentage of patients reporting a bleeding resolution over time كانت أول ساعتين وأول 6 ساعات in favor of fiber. As time progressed تقريبا كانوا comparable النوفو 7 والفايبر كانت results of reporting the bleeding resolution over time كانت comparable. برضو at the same time الستادي ديت قاست الفيجوال انالوج سكيل أو البين سكيل at baseline و over time. في الأول كانوا comparable الفايبر والنوفو 7. later on as time progressed وصل ان هو 0 visual او VAS score مع الفايبر at 48 hours، وفي النص كانت at 2 hours و 6 hours كانت الفايبر having advantage. later on they were comparable لغايه لما وصلت 0 at 48 hours. So in conclusion, both fiber and recombinant activated factor 7 exhibited similar efficacy in the treatment of joint bleeding with similar pain reduction. The two bypassing agent provided similar reductions similar reductions in hemostatic efficiency, bleeding resolution, with pain resolution, with no adverse effect. يعني as we can imagine إن هي ديت بلازما وفيها a lot of procoagulants but no adverse events were linked to the study or the study drugs reported. لما نيجي evaluate أو the study that evaluated the safety or efficacy of FIBA in surgical intervention was the SURF study, and هي كانت non-interventional observational cohort study studying 35 surgical procedures performed on 24 patients conducted in 19 healthcare centers around the world. Primary objective was to evaluate the perioperative efficacy and safety of FIBA in the routine clinical practice in patients with hemophilia A and B with inhibitors, or patients with acquired inhibitors to factor 8 or factor 9. The outcome measurements was a patient demographic and baseline characteristics, surgery type with severity, assessment of the intraoperative or post-operative hemostatic efficacy. السيرجنز عملوا لها assessment والهيماتولوجيست as well, assessment of non-serious or serious adverse events related to the FIBA measurement and estimate of the intraoperative and the post-operative blood loss. The inclusion criteria كانت congenital patients with congenital hemophilia A or B, وكانوا patients that were scheduled for elective surgical procedures and treated with FIBA first or second line for preoperative hemostatic control. Exclusion criteria كانت non hypersensitivity أو أي lab أو clinical signs of DIC, clinical indications of significant liver damage أو recent history of أي thrombosis. The dosing regimen كانت in a dose of 50 to 100 units per kilogram every 6 to 12 hours during or after surgery, and the dosing did not exceed a maximum single dose of 100 units per kilogram or a maximum daily dose of 200 units per kilogram. Assessment كانت overall late post-operative hemostatic efficacy, intraoperative immediate post-operative hemostatic efficacy double surgeon. Hemostatic efficacy was assessed as excellent, good, fair أو poor. Overall hemostatic efficacy of excellent or good كانت 100% في المايلد ريسك اوبريشنز. في المودريت ريسك بروسيدرز كانت تقريبا ربع العيانين rated it as fair while ثلاث ارباعهم rated it as excellent او good. في السيفير ريسك بروسيدر more than 90% rated it as excellent efficacy in controlling أو assess أو يعني rating of hemostatic efficacy more than 90% and fair in less than 8%. In the intraoperative hemostatic efficacy by the surgeon تقريبا كانوا نفس ال numbers زيها زي الهيماتولوجيست. نيجي للسيفتي والادفيرس events. Out of 12 adverse events كانت 8 non-serious unrelated adverse events, واحدة non-serious product related events, 2 unrelated serious adverse event, واحدة product related serious adverse event, وكانت اللي هي product related serious adverse event في moderate risk surgical procedure. Out of this SURF study, the key learning points was in the prospective observational study, FIBA effectively and safely controlled bleeding in hemophilia patients with inhibitors undergoing surgery. 12 studies published over the past 15 years have described the successful use of FIBA in inhibitor patients undergoing surgery, with more than 250 major and minor surgical procedure, والهيموستاتيك efficacy زي ما شفنا كانت ranging من 75 to 100%. في studies that studied الفايبا أو activated prothrombin complex concentrate prophylaxis, البروف study, وبرضو البرو 8 البرو factor 8 inhibitor bypass activity study. الobjective كانت أو الobjective of prophylactic treatment is to reduce the number of bleeding episodes, prevent all-the-way arthropathy, protection from damage, deterioration, prevent life and limb threatening bloods, convert severe and moderate disease, severe to moderate disease, improve the quality of life, maintain a minimum level of factor 8 أو factor 9 with minimal level of bypassing agent to achieve effective prophylaxis. الديت كانت inclusion والexclusion criteria to jump بتاعه البرو فاكتور 8 انهبيتور باي باس اكتيفيتي ستدي، وديت بتاعه البروف ستدي. البروف ستدي كانت حصلت around 17 centers globally، والستدي duration كانت 12 month، ونمبر اوف patients كانوا 36، 17 prophylaxis و19 on demand. والبيشنت تايبز كانوا هيموفيليا A and B، والايج كانت من 7 to الرينج من 7 to 56، والمين كانت 23 years old. والدوز كانت في البروفيلاكسيس arm 85 every other day on demand standard dose and dosing in interval as described or as prescribed by the treating physician. الفرق بين الاثنين ستاديز ان البروفايبا كانت كروس اوفر لكن البروف كانت بارلل. خلص بسرعه 5 minutes بس. الفرق كان ان او الريزلتس التيبل ديت لطيفه كانت بتوري ريزلتس ان 62 reductions in all bleeding episodes في البرو فاكتور 8 bypass activity، و 61 reduction in joint bleeding، 72 reduction in target joint bleeding, nearly 62% who responded well defined by the study protocol ان هم يبقى اكثر من 50% reduction in overall bleeding. 6 patients reported zero bloods and no thromboembolic events were encountered. في البروف كانت برضه نفس الدوز 85 plus or minus 15 unit per kilogram every other day، وكانت الريزلتس were comparable although they were higher، كانت عدت ال 70%. والمشكله كانت الرئيسيه كانت في ال 7 cases of hepatitis B antibody positive attributed to the passive transfer of antibodies from plasma used في الفايبا او it was thought to be used from فايبا. لما upon further evaluation لقوا ان 4 related severe adverse events for a positive hepatitis B surface antibody. 3 considered related to the investigator and whole investigator did not know about them from the beginning, and 1 considered related to the sponsor نفسه او الدرug with no evidence of viral transmission occurring, and development of positive hepatitis surface antibody titer in the 3 out of 7 patients were most likely result of كده خلصت ولا likely a result of prior vaccination or revaccination or history of hepatitis B مش من الفايبا. This was evaluation دي was done to further endorse الeffect أو السيفتي بتاعت الفايبا. And learning outcomes in the prophylactic therapy demonstrated a statistically significant decrease in the median annual bleeding rates of all blood types when compared with the on-demand therapy, where 2 out of 17 patients in the prophylaxis arms who completed 12 months of the study had 0 bleeds, where the development of new target joints were substantially less in the prophylaxis arm, and there were no thromboembolic events reported during the study. ده الدوزنج جايد لاينز usually a dose من 50 ل 100 unit per kilogram. mostly ال 100 بتبقى في السوفت تيشو هيمريدج او في السيفير بليدنج او البوست اوبراتيف. والاوفرول when we assess the overall safety profile of activated prothrombin complex, a lot of studies have proved its safety, and it's been used in hemophilic patients with inhibitor over 40 years. Safety profile well established and well characterized as demonstrated by the studies, where 0 to 2% related adverse events in the clinical studies. And the global pharmacovigilance data بتاعتها ان هي 55 fiber related adverse events were reported over the 10 years من 1990 ل 99, وبس اكثر من 7 مليون يونت of activated prothrombin complex administered ما بين 1975 and 2016. Or activated prothrombin complex is well tolerated in both demand and prophylactic setting, and only 54 thrombotic thromboembolic events were reported in the 40 years, where a rate were less than 0.005%, and at the end, it is a majority of FIBA-associated thromboembolic events occurred in the presence of recognized risk factor or concomitant medication. At the end, I would like to thank you.